Yes, this. A survey of Asia-Pacific Academy of Ophthalmology's APAO's members' attitude towards oral waste and sustainability effort. So you guys must have known that a cataract surgery in the UK generates the equivalent amount of carbon dioxide emission equivalent to driving a car for 500 kilometers, and that is 20 times more than a cataract surgery done in India. So this creates a deep concern towards our work as an ophthalmic surgeon to the environment, the impact that we are doing to the environment. We all know that there are two sustainable surveys as conducted in the North America and European in 2020 and 2023 respectively. It reveals a strong willingness amongst the ophthalmic surgeons to adopt a more sustainable practices in the OR. But what about the Asia-Pacific ophthalmologists? What do we feel about it? So to answer that, a special task force has been formed in 2024. I thank all these people, especially Dr. David Chang, for their help and support in this project. An online survey was distributed to the members of APAO via emails from February to March 2025. This is just the preliminary data. The survey is currently still ongoing. It is available in English, and we translated it to Mandarin and Japanese. Similar questionnaire that were used in the previous surveys were also used in this survey to allow for direct regional comparison. This is the result. We have close to 2,000 respondents coming from Japan, Indonesia, China, the Philippines, Malaysia, and etc. Most of them have 10 years of experience. High cataract volume surgeons, they work in a public or government hospitals, and majorities are male. So this is the result. Close to 94% are concerned about global warming and climate change. And this data is closely resemblance to our Western counterparts in the previous surveys. When we ask what is the perceived driver of OR waste, 2/3 agrees that manufacturers play an important role in reducing OR waste. We want the manufacturer to offer more reusable instruments as an option and to consider the environmental impact when designing and packaging their instruments. More than 60% agrees that regulatory body should allow surgeons discretion in reusing these medical supplies, and they want medical societies to advocate for it. And of course, we do want more clinical studies to show the safety of reusing these medical items and supplies. And this is an interesting one. This data shows that there is a higher proportion of respondents in the Asia Pacific who are already currently reusing medical supplies in the Asia. As you can see, more than 2/3 are reusing phaco tips and IA tips, 40% both the phaco and IA tips. More than half are already reusing irrigation solution and bottles. For those who are currently not reusing, 1 in 5, around 20%, are willing to consider doing so. So the same goes for intraocular pharmaceuticals in cataract surgeries. Globally, concerns from endophthalmitis and malpractice liability significantly reduce the willingness of reusing these supplies on multiple patients. And comparison across the region, the same factors such as cost saving and environmental consideration increase the willingness of ophthalmic surgeons to reuse supplies on multiple patients. Major factors that drive the single-use instrument in our fields are patient factor, 80%, performance of the instruments, and yeah, we don't want to get sued. So if you could choose an instrument with equal functionality, equal performance, and equal cost, 65% of the APAO surgeons would prefer to use reusable instruments. And this is incomparable with the European surgeons. 77% of them will prefer to use reusable instruments. So in conclusion, in this preliminary survey of close to 2,000 respondents, the data closely similar to our Western friends. Almost half of those are already reusing and willing to reuse medical supplies on multiple patients. We rank pretty similarly in our factors influencing our willingness to reuse these medical supplies. And this preliminary data shows potentially that there is a strong consensus that ophthalmologists worldwide are very concerned about global warming and climate change. With that, I thank you.